Have you been internet terrorized about the side effects of oral contraceptives? Today, I'm going to present to you about the myths and the realities of oral contraceptive use and what the most common stories are out there that need to be either debunked or acknowledged. I'm Dr. Rahi Victory, a reproductive endocrinology and infertility specialist. Make sure you watch till the end of the video where we are going to touch on the important topic of, does the birth control pill cause breast cancer? So the very common myth we all talk about and we all hear about is the birth control pill is going to increase your weight. We see it on the internet all the time. It's all over social media, and certainly we hear it from people left, right, and center. People come in all the time saying, oh, my sister took the pill. She gained all sorts of weight. I took it before. I gained all sorts of weight. My friend took it. They gained weight. But is it actually true? So there is the Cochrane meta-analysis that looked at this, and they actually have very rigorous criteria. They analyzed 49 different studies, 85 different types of weight measure, and they looked at 52 different comparisons and different pill formulations. Their analysis very clearly showed that there was no relationship between weight gain and the birth control pill or any type of contraceptive formulation at all. Now, we see it all the time and people talk about it all the time, but are you really going to argue with 49 different studies? It's pretty hard to put up an argument with that degree of scientific background to support the fact that it doesn't actually exist. That's not to say people don't gain some weight on the pill. Some people do. But the problem is lots of people actually lose weight on the pill too. And so when you look at this on average, you're not actually going to gain much weight simply by taking any kind of oral contraceptive formulation or even something like a Mirena IUD. So if you're worried that you're going to gain weight, or you're watching all the blogs and posts and so on that say people gained a ton of weight taking the pill, it's evil, don't do it, it's not actually true. Number two story about birth control pill, it's going to render you infertile. We all hear it. I'm Middle Eastern. I know many Middle Eastern people have graduated from the TikTok School of Medicine where my whole family thinks they're physicians. My dad thinks he graduated the same day I did, even though he's never gone to med school. They all say hormones are bad for you. It's just some automatic kind of God-given knowledge that everybody has. It's actually not necessarily true. So the question is, does it render you infertile? Is taking the pill to prevent a pregnancy going to prevent you from ever having a baby? And the answer is this is being closely studied. Now, we do know that using the estrogen and the progesterone in the pill does influence your body's own hormones so that you're not releasing an egg, so that your cervical mucus thickens, and so that the uterine environment becomes unfavorable for an embryo to implant. But once those hormones are gone, is there some sort of long-lasting effect? So this is being studied, and there's a great big study of multiple other studies that included almost 15,000 women in it. And in that study, they analyzed how long it took these women to get pregnant. 83.1% of those women became pregnant within 12 months. And that's completely normal and standard and was comparative to all of the other women who never took the birth control pill. So when grandma's screaming at you saying, don't take the pill because it's full of hormones and these are bad for you, tell grandma she's actually not scientifically correct, because there is no evidence that the birth control pill actually has any long-term impact on your fertility. And in some circumstances, especially for women with polycystic ovarian syndrome, endometriosis or adenomyosis, it may even actually have some beneficial effect in mitigating or reducing the side effects of those conditions on your fertility. So it's not necessarily all bad, and it certainly is not going to render you infertile. So one of the things I see all the time online is people posting that the birth control pill is going to mess with your microbiome in your gut. What is the microbiome? Well, it's a bunch of bacteria that are very important for your overall health. Now, a lot of people don't know this, but we all have good bacteria and bad bacteria in our body, and those good bacteria are really important for a variety of functions, including your gut health, risks of cancer sometimes, things like inflammatory processes. And in the uterus and in the vagina, they're actually critical to your success in getting pregnant. So we certainly don't want the birth control pill rolling through your gut, playing Star Wars with your gut bacteria and destroying all the good bacteria, because that would obviously be harmful. But does it? Well, I see it all the time. There's all sorts of naturopathic posts saying the birth control pill is damaging to your gut microbiome. So they studied this. They took 160 Danish women and they followed them for several months and they monitored multiple different sites of bacteria. So they looked at the stool and the vagina and the uterus and the gut, and they analyzed the gut bacteria in relation to their estrogen level, to their pill use, to non-pill use. They kind of checked everything. There is no impact whatsoever of the pill or any formulation of the pill, and they tried 3 different kinds, as well as the IUD that contains levonorgestrel or a Mirena or a Kylena IUD. There was absolutely no impact whatsoever on the gut microbiome. In fact, it had 0 impact whatsoever. So all those claims that it's going to disrupt your gut microbiome are actually factually incorrect. It just doesn't make a difference, and you don't need to worry about that. So taking the pill is not going to disrupt your gut flora. It has no impact whatsoever. And there are changes in relation to your body's natural changes in the gut microbiome during your menstrual cycle, but they have nothing to do with whether or not you are on a pill. Okay, last one. And finally, the big concern about whether or not the birth control pill causes cancer, especially breast cancer. So we've known for decades now that taking the oral contraceptive pill can reduce your chances of ovarian and endometrial cancers by almost 50%, especially if you're someone in a high-risk category like PCOS, where your periods are irregular. It is critical that you keep those regular, and the birth control pill is a great way to do that, thereby reducing your risks of lifetime development of endometrial or uterine cancers. So we know it's very beneficial there. But what about in the breast? Obviously, 1 in 8 women are going to develop breast cancer, and hundreds of millions of women worldwide are using the pill. It would be a disaster if it had a significant impact on your breast cancer risk. There are innumerable studies that have looked at this, and the important data that has recently come out is it actually is very confusing because it depends on which type of cancer you're talking about. So in a systematic review, looking at dozens and dozens of studies of the association between oral contraceptive use and breast cancer, they looked specifically at what type of breast cancer. So you have to understand that the birth control pill contains estrogen and progesterone. And so some birth control pills have certain amounts of estrogen, certain amounts of progesterone. Some of them vary during the cycle, and some of them have a constant amount the whole time. So the question was, what about the various types of breast cancer? Because we have estrogen receptor positive breast cancers, we have progesterone receptor positive breast cancers, and we have some that are triple negative. We have something called HER2/NEU, NEU. That's another type. So all of these are various receptors that can have a very significant impact on the type of cancer and what the risk is. So in a systematic review that looked at the influence of oral contraceptives on breast cancer, in the estrogen receptor positive group, there was actually a reduction that was non-significant in breast cancer. So it certainly didn't increase it. Maybe there was a trend towards a decrease. In the estrogen receptor negative group, though, they did see a small increase of about 31% of increased chance of developing breast cancer. And then when they looked at HER2 positive, it showed no impact and maybe a non-significant reduction. And when they looked at the triple negative cancers, they saw a non-significant increase in risk. So it's kind of all over the place. You got some that are non-significantly reduced, one that's non-significantly increased, and then one that actually was statistically significantly increased. And the weird thing is, it's the estrogen receptor negative cancer, which doesn't make a whole lot of sense because we're giving you a little bit of estrogen in the birth control pill. Why would it be the estrogen negative cancer that's developing? The authors themselves claim they can't explain it. So I thought, maybe this isn't good enough data. Let's look a little bit deeper. There are other studies. In an analysis of over 150,000 women exposed to the birth control pill from 54 different epidemiologic studies, they saw a 7% increase overall. A 2010 analysis from the Nurses Health Study, which was a huge analysis of females that were in nursing, and they had all sorts of data collected from them and followed them for years, showed that 116,000 women were in that study, 24 to 43 years old. There was a slight increase in risk, but it did increase over time. But it was only present when you took a triphasic pill, which is where the doses of the estrogen and the progesterone vary over the course of the use of the pill in that month. And then there was a 2017 study from Denmark where they looked at it, and they showed about a 20% increase, but it went anywhere from 0% all the way up to 60%, depending on the type of cancer and the type of birth control that was used. They did show again that the longer you were on it, the more risky it was. So can the birth control pill actually cause breast cancer? Well, it's certainly possible that there is a slight increase in breast cancer, but we need to put this into perspective. The incidence of breast cancer in very young women is very low. And to put it into comparison with other things that young women are typically doing, you really have to get context for this. So something as simple as drinking alcohol carries a 24% risk in your breast cancer risk. So if you are a light to moderate drinker, your risk of breast cancer is actually higher than what they're seeing in the studies from taking the birth control pill. If you're a heavier drinker, it's as high as 60% higher. So something as simple as teenagers or young women in college drinking heavily on the weekends increases their breast cancer risk more than taking the oral contraceptives do. When you look at recommendations from the societies like the National Cancer Institute and so on, they all say essentially the same thing. Overall, the risk is very low and the benefits far outweigh the risk, but there is actually a slight increase. And finally, are there any other risks we didn't talk about? Of course, there are other risks. If you're a smoker and you are using oral contraceptives and you are over the age of 35, it is contraindicated because the risk of heart attack and stroke is drastically higher. And most importantly, at any age, if you are sedentary, a kind of more of a couch potato lifestyle, you are struggling with a high BMI, or you have risk factors for forming a blood clot, including certain conditions, diseases, cancer, all sorts of different things, you can be at a very significantly increased risk of developing blood clots. Even if you have none of those risk factors, your risk is double. Blood clots can go from your legs up into your lung, and that can do very serious damage, including being fatal. Very uncommon. We do not see it. I've been using this for over 20 years now. I've never once had a fatality from it, but we have seen women that have suffered pulmonary emboli or deep venous thrombosis, and that can be a serious risk, so make sure you review this with your doctor first. I hope you've enjoyed this video. We've debunked some of the myths, but brought some important information to you about breast cancer. Consider what's right for you. Talk to your doctor to get the best information.